Hello and welcome to another episode of SightCall Sessions. I am Carmela Fortin, Vice President of Demand Generation at SightCall, and we're joined by David Swift, Vice President of Marketing. And today, our guest is Thomas Cottereau, CEO at SightCall. And our goal today is to talk about trends in virtual healthcare. So the first question that we have for Thomas is around patient care. And Thomas, as you know, we're all patients, right? We shouldn't have to fight for time with our healthcare providers and the time that we spent dedicated on the call talking to the doctor. So with the time that could go to a patient call from a provider perspective, sometimes it gets eaten up by administrative tasks. Can you tell us more about how the evolution of patient care refocuses on more provider sessions and really how we can get more time between a patient and their doctor to refocus on the patient symptoms, the patient needs, their follow-up questions, and really prioritizing their holistic well-being?
Yeah, hi everyone. This is a great question, and as everybody has in mind, the healthcare landscape has been reshuffled with the COVID. Right before the COVID, you didn't feel well. What was your action plan? You would go, to the doctor's office. During the COVID, well, actually everything was closed there. So you started to use this teleconsultation. You went on the website, selected someone that you didn't even know, and tried to find, a time slot to get a teleconsultation running. And now we're on this post-COVID era that I believe is here to stay. So what is this new landscape that we are facing? First, on our side as patients, right? When something happens, then we want to be connected with the right person at a time that is convenient for us, in our busy lives. And also, we want to be in person whenever it's needed. In a lot of different circumstances, it's not. So the combination of in-person and remote care, I think, is the current, state of the art of the healthcare patient to providers interactions. So on the provider side, it's also, a big change because for them, imagine that, some of them were dedicated to go at home on, spending their days, in their car, going to visit one patient to another. Some others were in their office where, out of the appointment would line up and would see one patient after another. And now trying to mix out of this virtual and in-person is kind of a complex equation. What we want to make sure is that these care providers were, dedicated to this mission of providing care, that are not trapped into getting into IT, into tools that are hard to start, into, the burden of trying to mix their agenda in person and remotely. So that's really where, things start to be a little bit complex to really adjust well in this new landscape of healthcare, combining in-person and virtual care.
That makes a lot of sense. Yeah, David, anything from your end?
Yeah, I think Thomas really did a good job there in describing the current situation. I mean, just to share some data on some recent consumer surveys, actually, they found that 64% of consumers today would actually prefer to see their primary care provider virtually if they could. And I think that's a big indicator on adoption of this post-COVID norm now. It was a quick fix, and now consumers and really patients have made that assessment that virtual care is something that they want, but the expectation that they're placing on the type of interaction that they get with their provider is always going to be one of personalization, right? Of just having that time with their provider. So as Tamam mentioned, what happens before you have that video teleconsultation and what happens after is actually very important. It has to be seamless. It has to be integrated in a way that the provider actually gets to spend time with a patient in a virtual setting rather than finagling with a technology tool.
Yeah. Yeah, that making sure that we're really refocusing on that patient time and less of that finagling is definitely the direction that we want to go. And Thomas, we're grateful for your time. We know you're a busy CEO, and our audience is really eager to hear more about the recent healthcare event that you attended. Can you tell us about some of the leading challenges that came up originating from virtual healthcare?
Yeah, I spent actually last weekend with a lot of care providers, right, from medical doctors to nurse and all of the ecosystem, and that was very, very insightful. Spending all of this quality time with them, and a lot of them were using SightCall on their day-to-day life. So interestingly enough, the first part of this conference was about end user coming to us at SightCall just to tell us thank you. So I didn't understand why the first time. Okay, what did we do? Really the answer was, hey, you really changed our life, because the previous solution that we were using was really hard to manage. It was hard for us. It was hard for the patients, and as a result, there were a lot of video consultation that did not happen. Even if they were, scheduled, they could not happen. A lot of frustrations, obviously, rescheduling, trying to figure out maybe because it doesn't work with this patient, they're going to have to go on site, and, creating a whole mess of the organization. So interestingly, this company implemented a full new process within Salesforce on SightCall to be able to have, a clear path and really remove all of the administrative burden, all of the technology side from the care providers, so that they can really focus on what is important to them. For the reason why they do this job is to be in front of their patients and helping them in their day-to-day.
Yeah. Well, we're definitely grateful that you were there to give us a glimpse of what their day-to-day is like. And in terms of where you see the future of healthcare software going and where you see it evolving in the next 5-10 years, what do you see on the horizon?
I think it's a combination of two major, shift in the technology and solutions that are today made available to the ecosystem. The first one is this hyper personalization. I think we are getting at a stage now where it's not one size fits all. It's all about, this different type of organization, this different type of care, this different population of patients. And by the way, each and every patient is different from the other one. So each of them is having specific goal, needs, request, schedule, programs associated to the care that they need to receive at this stage of their journey. Right? So this hyper personalization is going to change all of these interactions that are happening between the providers and the patient. The second one that will come, also to reinforce that, obviously, is AI. It's hard to have a discussion around, the future of technology without mentioning AI. See very interesting, AI improvement right now. First step is really, again, to remove some administrative tasks from the providers. For example, generating reports for them immediately. But then also are coming more verticalized AI to analyze also the interaction between the provider and the patient, and provide some guidance, provide some recommendations. And the more the AI engine continues to learn about all of these different pathology, the more it's going to be able to provide insightful recommendation to empower, these care providers with even potentially identifying some patterns that they didn't hear during a discussion.
And how do you see some of these telehealth providers balancing that future of AI with security, with compliance, and with that really valuable time that they're spending in a virtual call with a patient?
It's all about empowering these people, right? It's not about replacing them. I'm not ready to have a teleconsultation with an AI bot, and I don't think I will be tomorrow either.
Yeah, I wouldn't either.
Here we're talking about humans, right? Discussing
Yeah.
with humans, analyzing, your feeling on all of this stuff. But again, for me, this AI is a fantastic assistant, right? Co-pilot that can really help guide, analyze this interaction and provide insights. It's designing this evolution. I think some of the providers will take it, from there and implement it right in this combination. And again, it's very, very important. If there's one thing that everybody should keep in mind in this AI implementation, beyond all of the, security, data privacy that should go with it, it's this combination of human and AI interactions on how do you make the process right to get the best of these interactions between humans helped by the AI.
That's helpful. In terms of the process, there's so much that goes in to the pre-call. There's so much that goes into the post-call and what the provider is doing offline, whether it be notes, prescriptions, the list goes on. David, is there anything that you see pre-post-call or in terms of those administrative tasks that might impact the landscape of how a provider is interacting with their patient?
Yeah, I mean, in the pre-call setting, in just a today, I mean, what needs to happen is ensuring some level of guidance towards robust connectivity, right? You have to ensure that you're going to have a successful patient-provider interaction. And in post-call, like Dama mentioned, is we have to focus on how do we combine all of the information gathered into a structured type of report that can be validated by these providers in an effective way and just truly increase more visits, right? And that's because there's kind of this gap. I mean, we have an elderly population, that continues to grow and develop more illness that need provider interactions, and they can't always travel to the doctor's office, right? And there's a survey. McKinsey came out with this report, and they analyzed national claims data, and they actually estimated that more than 50 million in-person visits per year could be converted to a virtual or telemedicine visit if adoption were extended across all these patient segments, because what they're seeing is you don't have to go to the office, and a lot of people actually just won't go too. So that's just claims data alone. And then there's people who are just deciding not to seek care. And
right.
It's all about having a healthy population, having a healthy life. And if you do this right, you can really change outcomes for people across the board.
Yeah. Yeah, that's definitely helpful. And Thomas, as you see this process combined with the evolving future of virtual healthcare, what is something that could really stand out to virtual healthcare providers that SightCall brings to the table?
I think the one thing that SightCall brings here to the equation is this deep integration into the full ecosystem, into the workflow, into the way these providers are organized and are managing their work, right?
Mm-hmm.
It's back to the basics. What is important there?
Yeah.
I want to make sure that if I have, a teleconsultation scheduled, then I would have a reminder that let us know that, hey, shoot, it's time to get it now. Give you just an example of one feature that we've deployed with some customers is that at the time of the consultation, actually, your phone will ring to remind you that, hey, you have this teleconsultation starting right now. And actually, the patient is already there in the waiting room. And maybe, this care provider was in another patient's house and would go into another room just to take it, from there. It's all of these, small touch point of the day-to-day implementation of the right solution through the workflow, through the workforce management, right? That is creating this change with a technology that works by the first touch. So like also with this, customer, they have a dedicated app with all of their appointment listed. They touch the link of the appointment, it starts. That's it. One touch to get it there. On the patient side, it's the same. They're going to have, their appointment and then the reminder, and there's always a link in there by one touch. No need to download an app, no need to enter any credentials, no need to authenticate. One touch, you get into the waiting room. And the providers, by one touch, gets you into this consultation. That's really how you make all of these experiences flow, all of these lives way easier, and actually how you increase the efficiency and productivity on the overall system.
That's fantastic. And it sounds like there's levels of personalization that's happening on both sides. So, personalization, empathy, efficiency happening, not just for that patient appointment, but also for the provider as well. So they can refocus on what matters most, which is patient care. So, Thomas, David, thank you so much for joining us today for this conversation. I think it's been hugely helpful as we see that future of virtual healthcare evolve. All right. We'll see you on the next SightCall Sessions episode. Bye-bye.
Thanks, Carmela.